Why would my speakers be muted?
However,
in progress.
Mute them.
is it?
Scott, this is Bruce. While we're waiting for the meeting to start, how did that lady do with the luxatio erecta?
Bruce, I'd appreciate it if you wouldn't talk to me in public like that.
That was the funny looking shoulder dislocation.
I know what it was. It was a joke.
Oh,
I have not gotten a follow-up. So she did fine on the trip to the hospital, but I've not gotten a follow-up post-arrival at the hospital.
all right. Very nice call to get a physician to the scene for that.
Yeah, I'll email the St. Peter's EMS liaison person and ask him.
Thank you.
You got it.
Hey, Bruce, after the meeting, can you give me a call? It's about a patient that went to Samaritan.
Sure.
Thanks.
Okay, so I was just looking at the list and I think we now have quorum. So welcome to the December meeting. And I'll get started. I have people review the minutes from October. If so, motion to approve the minutes.
Make a motion to approve.
I'll second.
Okay. So I apologize. I have actually almost 2 pages of disciplinary actions and correspondence to read in. So go get a cup of coffee or something. Christine Carrera, Brooklyn, New York, certification suspended for 1 year, effective 10/13/21, $22,000 penalty for violation of Part 800. Christopher Howland, Amsterdam, New York, certification suspended for 1 year, suspending stayed pending no further violations for 3 years.
I want to ask you a question. What are your thoughts about Sarah Beth Hedge?
Hang on 1 second, Mike.
Okay.
Is Mike hanging out with you?
Yeah, Rob, we're finishing up a conference call. We'll be right with you.
Okay.
It just
Mike, I just signed on to that Remac. They were asking me if
Sam, can you mute? Center for Allied Health Education, Brooklyn, New York. Technicalities. Center for Allied Health and Education, Brooklyn, New York, agency code 8091, assessed a civil penalty of $2,000 for violations of 10 New York CRR 66.3. Kevin McKeon, Lynbrook, New York, certification suspended for 1 year, effective 10/22, suspension stayed, on probation for 3 years, and a civil penalty of $2,000 for violation of 800.3 and 800.16. Giovanni Javiria, Flushing, New York, had certification revoked effective 10/22, and it was assessed a civil penalty of $2,000 for violations of Part 800.16. Ambulance service of Fulton County, I didn't realize that was still in existence. Based in Clifton Park, New York. Agency code 1712 had its certification revoked effective 10/27/21, assessed a civil penalty of $4,000 for violation of appeals to Article 30, Section 3012. Johnstown Volunteer Ambulance Corps, Johnstown, New York, agency code 1713, a certification revoked effective 10/27/12. Same violations and also Article 30, Section 3012. John Chinelli, Grand Island, New York, certification revoked and suspended, suspension stayed, and probation for 3 years, violation of Part 800.16. Matthew Martinez, Bronx, New York, certification suspended for 1 year effective 10/29/21 for violation of Part 800.16. And Robert Gala, Brooklyn, New York, had his certification revoked effective 10/27/21, assessed a civil penalty of 2,000 for violation of 800.16. Okay, you can all come back to us now. So committee reports. Done.
Okay, so academic or advisory committee just met prior to this discussion on epinephrine shortage of the 1 to 10,000, and the number of agencies are now going to need to be mixing up the 1 to 1,000 to make a 1 to 10,000. Unfortunately, Mike also mentioned, I guess Albany Med's having trouble getting the 10 cc saline flushes. I have not seen that yet at St. Peter's, but if it's affecting Albany Med, I'm sure it's going to affect all of us shortly. We discussed the mist form. It seemed to be working out pretty well. We also talked about hospital wait time, triage, and diversions, and we're setting up a committee to look into setting up a better call tree versus email versus text message, so that the versions can get out to everybody. Right now, it's pretty haphazard how that's being done. Let's see, there are a number of training courses that are out. Saratoga has an EMT original starting, Hudson Valley has an EMT original and refresher. Cobbleskull also has an EMT and refresher, and Cobbleskull has a winter symposium on January 8th, which is virtual and is free of charge. You just have to register for that. There was some discussion on EMS provider and gloves. I won't go into that at the moment. That's being looked into. There was some concern about JACO and our providers wearing gloves, not wearing gloves, which seems somewhat odd. Mike and Chris also brought up about the Omicron variant. Just be aware, it just came across the news that it's been found in California, so it's in the United States, no surprise. But everybody should keep up their guard. And again, it's really suggested by all of us who have not gotten their boosters, get your booster. I've been seeing a number of people who are about 6 to 7 months out that are now testing positive despite having two vaccines before that. Mike also mentioned Stop the Bleed, and Albany Med has resources if anybody wants to do a Stop the Bleed course at any of the schools. And that's basically it from advisory committee. Next meeting of ours will be in February.
Thanks. Remsco this last month was very heavy into the financials. Big discussion on how we're going to divide up paying for EMT classes based on the attendant versus the agency, and what's up front and what's waiting from the states. And continue discussion on a merger and alignment with RMs and Mountain Lakes. I think that was the major discussion topics for the Remsco. Don, did we have CMAC or SEMSCO?
No CMAC or SEMSCO. The next meeting is January 4th and 5th. That will be at the Plaza, downtown Albany. It will be a hybrid, so you're welcome to come if you want to come, or you'll be able to sign in virtually.
Okay. Mike, QI.
We did not meet today, but the one thing that I would just like to ask the physicians, if there's a specific topic you would like to see the QA committee take on next year, please drop me a note. We will continue to do our ongoing projects involving ketamine and cardiac arrest registry work, regardless.
Tim, report from the Hawk.
Hawk met on November 10th. It was a fairly short meeting and basically centered on COVID ops throughout the region. That was about it.
Short agency updates, BLS albuterol, Castle's Involuntary Ambulance going to CPAP for DOH October 22nd. No upgrades, and EPCR to Conic Valley Ambulance going to Medview. Pads, we have a bunch of these. Infinity Med Solutions update, Planet Fitness Saratoga, Planet Fitness Glendo, Planet Fitness Latham, Town of Greenport was an update, Proctor's Theater, AIM Services Incorporated, Saratoga Golf and Polo Club, Innovic, Morgan Stanley, St. John's Lutheran Church, Corinth Central School District, Stephentown Federated Church, Primaloft Incorporated, Rensselaer Generating, St. Joan of Arc Church, and Apple. So that's it for PAD. New business. Mike, you want to talk about hospital diversions?
I think we can all talk about hospital diversions. Rob, you want to lead us off on that one?
Yeah, so we have volumes up in hospitals, volumes up in the ERs, and there have been an increase in diversions recently, either for specialties such as psychiatry or overall hospital diversions for hours to days at a time recently. So we're looking at a better system to notify. This was coming out of the advisory committee earlier, the better notification system, streamline the process to get it out from the hospitals, and also make it easier to come off diversion and get everyone notified. Okay. And then part of that also, the next step is long distance transfers as we try to get patients out of the area where we have no room anywhere locally.
So the reason we threw in the long distance transfers is there's been a number of situations lately where long distance transfers that have not been able to be accomplished by our local commercial partners have led to extended wait times in our emergency department. One case in particular, I had a child over the weekend at Albany Med who needed to go to Mount Sinai for liver transplantation services potentially. We were unable to get that child moved in a timely manner because of ambulance availability. St. Peter's and Albany Med have been working with Empire and Mohawk on some meetings already. Those will continue, but we need to continue to focus on what other potential opportunities there are to move patients long distances because this impacts our patients. It also impacts flow in our emergency departments and out of our hospitals. So if anybody has any ideas or solutions, can bring them to me offline, that would be great. And I will bring them into that committee meeting we've already got going on the side because we need to come up with some better solutions.
Have one here for Omicron warning. We pretty much already took care of that with Don talking. Mike, do you want to talk about the matters?
So Matters is a program that was started by Josh Lynch out in Buffalo. It's medication assisted therapy in our emergency departments. It's a fantastic program. It's been working in conjunction with the Department of Health extremely well. And most of our emergency departments are actually enrolling patients in this. What it allows is a warm handoff for a patient with opioid use disorder to a medication assisted therapy clinic or provider. And that appointment actually is made in real time when they're in the emergency department. We're looking to expand Matters so that we'll have an opportunity to do this pre-hospitally as well. We've been working with Steve Bricado down in Greene County on opportunities there where they have the highest per capita overdose rates in the state of New York. And we have a project that will be going live that doesn't actually require any approvals along the way because it's going to be a assist the patient project. But I wanted to let everybody know about what direction we were heading with it. Basically, we also wrote it up in standard protocol format here that's now on your screen. And the idea is that what we are doing is not engaging somebody in medication-assisted therapy in the field. What we're doing is treating a patient for acute opioid withdrawal in the field, and then we are getting them to a medication-assisted therapy provider. That's a really important semantic tactic based on the regulation. This has already been tested and used extremely effectively in Camden, New Jersey, as well as Contra Costa, California. And this program is also just being started in Pittsburgh as well. We have not yet enrolled any patients. We have only trained a couple of paramedics down in Greene County to participate in this. We look forward to getting this off the ground and making it successful there, and hopefully bringing it to other places. I don't see this as a one-size-fits-all solution for New York State. I see this as just one more tool in the toolbox to hopefully provide us an opportunity to give people basically give people a chance to feel better, recognize they can have normal lives, and engage in the therapy that will ultimately be successful. So, any questions?
Mike, will we have to have approvals to get and carry buprenorphine? Because I don't think that's on the list.
So if you'll notice this one, if you scroll down a little bit, in this case, this all doesn't talk about who's going to carry the buprenorphine. And that's pretty much a key here. Right now, the way this program will be instituted in Greene County is when the medication-assisted therapy provider has a conversation with the patient, they will then contact a pharmacy who will then fill a prescription and will have the prescription delivered to the patient. If ultimately we get a protocol like this one approved and we can get through the Bureau of Narcotics Enforcement's concerns, we would then have the ability to put buprenorphine, naloxone on board ambulances. But the program in Greene County will not involve carrying buprenorphine on the ambulances.
Are the Matters medical directors all ex-license waivered people then?
Yes. All ex-licensed and a significant amount of exposure to medication-assisted therapy. Locally, Emma Furlano, who's one of our toxicologists and a former local EMS provider, is one of the folks that's taking a lead on this, as well as Adam Rowden, who works with a couple of EMS agencies and is also one of our toxicologists. Dr. Cordy is also serving as coordinator on this to help out. So we've got a number of local folks who are ready to answer questions and help as well.
Any discussion on this? Questions? Okay. Any questions or discussions for the floor? Open forum.
Is that just informational, Mike, or did you need a motion on that program to pilot that program?
Sorry, Sam, I don't think I need a motion on it, but I would welcome one. The other thing I would certainly welcome from this group would be a motion to suggest that buprenorphine naloxone be considered for addition to the New York State EMS formulary for very specific approved agencies.
Okay, I'll make that motion on adding the buprenorphine for specifically approved agencies in selected clinical situations.
I'll second it.
Yeah,
Thank you
all in
both.
favor? Any further discussion? Okay, all in favor?
Aye.
Any opposed? Okay, that carries. So
you.
that's, go ahead, Mike. No. Any other topics for discussion?
Dr. McHugh,
Yes.
it's Carol from Mohawk. I just wanted to let you folks know that after many years of working on this project, we have finally gotten approval as an ambulance transfusion service, and we have contracts with Albany Med and Ellis. I'm working on one with St. Peter's Health Partners, so Mohawk can now transport blood. Our paramedics have all been trained.
We're very thankful for that.
That's great news.
I think the one thing that we should do right now is, as a committee, send a quick thank you note to Deb Funk, who got this process started so long ago, because that's exciting. So we'll now have both commercial ambulances will be able to transport blood, which is absolutely fantastic.
Right, for now, we're limited to Albany Med and Ellis until we get our St. Peter's Health Partners contract signed. Unfortunately, you have to have a contract with each blood bank that you're going to be working with in order to do it. So it is a little time consuming.
Regarding your status with St. Peter's, I have talked with our senior leadership, and that is all in the process right now.
Yes, correct.
I would
Carol,
point
right
out that
now-
the regulations as written provide an adequate amount of opportunity for apologizing and sending a letter admitting that you acted outside the direction. And I would suggest that if this was needed to be done tomorrow from St. Peter's to the Med, that it be done.
Carol, just regarding the simplicity of the paperwork, Empire, when they started doing it, made the most simplest forms yet met the requirements possible. I don't know what forms you have, but it would be great if the forms could mirror each other and they both say Empire/Mohawk, rather than having people trying to figure out, all right, who's transporting, which paperwork do we fill out?
I'm not sure what paperwork they use. If you want to send it over, we can look at it. We're using the paperwork that the state requires us to use.
Yeah, we pared that down just a tad. I'll get it to you.
Thank you.
I guess I would take it a slightly different direction, which would be, Bruce, if you have approved paperwork and that paperwork could then be added in for Mohawk, there are other agencies that have the ability to transport blood in this region. And I would just make that a regional set of paperwork just to make life easier.
That's exactly my point. Thank you.
I agree.
Any other discussion?
Dr.
And thanks, Carol, for all the effort you guys put into it. Go ahead, Art.
Just to keep you updated, we're receiving about 20% less patient care reports. I reached out to Peter Brody, and they may be soon coming up with a solution with a validation rule so that the receiving hospital is documented with their new documentation standards, so that the receiving facilities receive the PCRs. So again, there's been some back and forth about this over the last couple of months, but again, it continues to be an issue.
Okay, we have a kind of a light agenda for today, so everybody keep COVID on your minds and stay safe.
Happy holidays, everybody.
Yep, and I think we need the official motion to say we're going to skip January, meet up again in February. Mike? Okay.
Hey, Rob, it's
Yeah.
Chris. I got some email chatter back about that question with the gloves.
Okay, good. Just to give everybody a little bit more background, the glove question was that there's a joint commission requirement that within the hospital, staff does not wear PPE while transporting patients within the hospital. And one hospital decided this applied to EMS as well. So that's the background. Chris?
So I asked our accreditation and regulatory coordinator about that question, and she wrote me back an email stating that, I'll read it, our task from the Joint Commission is that we maintain an environment that provides safe, quality care for our patients. And then she has a chapter from the infection prevention section in the Joint Commission, which states the Joint Commission is not prescriptive but interpretive. They could and should hold us accountable for an infection prevention fail orchestrated by one of our customers or vendors. She let our infection prevention specialists weigh in as well. But it was recommended that personnel remove their gloves upon entering the building, conduct hand hygiene, which is required when removing gloves per policy, and then replace gloves with clean ones. And then our infection prevention specialist confirmed that statement. So I don't know if there's any further discussion from the group.
But we'd still be touching the same handrails with gloves. They just want new gloves. So we could put gloves and hand sanitizer at the doorway and change immediately, which is just ridiculous.
Right.
May I make the suggestion that we actually write a letter on behalf of the Remac to St. Peter's, asking them to reconsider and make sure that any policies that they are establishing take the safety of our EMS providers into account? Because this just doesn't make any sense. Or rather than going formal with this, Chris, Dean, can you carry this back as saying that this group thinks that this is nuts? Politely, of course.
Of course. I did CC you on the email, Mike. You're welcome to voice your opinion as well. So
I
will
certainly
return the message back, but perhaps that letter to Jacob would be appropriate.
I don't think Jaco cares. This
I don't
is
think
something that
Jacob
sounds
cares
like
either.
it was. No, this sounds like this was a St. Peter's interpretation of a Jaco comment.
I think honestly, you might want to bring this to the nurses committee. And if the rest of the hospitals laugh at it, then you kind of have their answer there.
Will do.
Good idea.
all right.
Okay. Thanks, Chris.
Thanks, guys. And gals.
Okay, everybody. Happy holidays, and I will see you in February. Well, much
Happy
before that for most of
holidays.
you.
Bye-bye.